headquarters of common sense.
Talk Radio.
Let's talk a little bit about Sajid Javid. I mean, he did what I think a lot of us hoped that he would do, and I'm sure that your intervention with him at King's College Hospital a few weeks ago probably did some good, if nothing else. He says he's now not going to impose the vaccine mandate. You won't have to lose your job if you haven't had 2 vaccinations. But there's now a sort of slightly confusing period to come, isn't there? Because there's some kind of consultation going on. What can you tell us about that?
Well, I would say it's primarily a confusing period. I don't think we've got clarity on what's going on at the moment.
Right.
The main concerns are that for students and for new appointees to positions or people who want to change position within trusts, there might be the possibility that trusts are mandating COVID vaccination. You know, look, we've kicked COVID vaccination as a mandatory requirement right out of the water. You know, we've argued it, we've proved it, the government's made a backtrack on it, and I really don't think there's any grounds for that to happen. I'm very pleased to see this morning there was an email from the University of Manchester saying that while they recommend that you get a COVID-19 vaccination, it's a matter of choice and they're not going to be requiring students to have it.
Right.
So those sorts of letters are starting to be seen now, and people probably should gain some confidence that most organisations are going to come out in that direction.
Right.
If an organisation doesn't come out in that direction, there's going to be a lot of pressure on them to explain why they've come up with this idea.
Yeah, I mean, Boris Johnson was asked the question yesterday by Esther McVeigh, which was a great question, which I think he gave the sort of right answer to, but he wouldn't give an absolutely firm, yes, we are now reversing that particular decision. What he did say was he still believed that it was the right thing to do to get vaccinated. So he's obviously still keen for people to get vaccinated, but as long as they feel that they can't impose it, then I suppose that's at least something.
Yeah, I mean, there's been this general message of vaccinations good because that encourages people who are going to benefit from the vaccine to think, I'll take up the vaccine. And I think that line is not going to stop for a long time. And what the public are asking for, what I've been asking for, is for nuance, is for separation into where is it appropriate.
Yes, exactly right. So as far as you're aware, if it is being given as a sort of responsibility for each individual health health board, if you like, and health trust, does that mean that some might impose it?
That there's a possibility, but that they've got to have justification for doing so, really. And I know that some managers are very keen on mandates, but they've now got to be in a position where on their own they've got to be able to stand up to their employees, they've got to be able to stand up from pressure from outside, from the public. And so I think most of those organisations will see it's difficult to put that into place. And I think you'll find that as the public's against it, there'll be a lot of pressure for people to justify doing such a thing.
Absolutely right. And what about care home workers? Because obviously many of them have already lost their jobs. Some of them moved into the NHS, in fact, before it was then announced that the same rule might apply there. Have you heard anything about what is likely to happen in care homes as far as whether some of these people might get their jobs back?
Well, I think they're certainly allowed to go back to work, whether their employers are offering them the jobs or not at the moment. Again, it's not clear. I'm just about to do a question and answer session with Stephen Jackson again, the lawyer who helped us with putting forward the legal challenge, because there are a lot of questions that aren't really clearly answered here, and we need some legal advice on what's supposed to be happening in the next weeks. I don't think the government's made a very clear U-turn in the slightest.
No, absolutely. And as far as the way that the COVID sort of wave, if you like, for want of a better word, is now going, what's your view of sort of where we are? Because it almost feels as though we're very much at the end of it. It may well be that those who say there's other variants that will come may be proved correct, but it does feel rather that we're kind of on the way out of it, doesn't it?
Yeah, I mean, COVID, like flu, kills. I mean, let's not forget that we don't like disease in society. We don't like people getting sick and dying, and we don't like the sadness and the difficulty that comes with that. But it is on the scale of flu now, and we need to treat it appropriately.
Oh, I think there's no doubt about that. I mean, I personally know lots of people who have got it, but it hasn't been a problem for them. And in many ways, that's a sort of good thing, isn't it? Because you want that to be the case. You want for people to be able to kind of, have experienced it without it being a massive inconvenience, really.
Yeah, and in some ways, it's a bit of a workout for your immune system if you don't get really sick from it, or develop a stronger response to the virus. Then our immune systems are designed to work.
Yeah.
There's across the whole of our body that when you stress the system, it actually gets stronger. That's how you get physically stronger, by stressing the muscle. You actually rip the muscle fibers. It hurts for a while, but then the next day you can do more. So there's this process called hormesis, where stress brings benefit. It brings longevity.
Yes, I think that's right. And what are you seeing actually in the hospital at the moment where you are, as far as like in admissions from people with COVID?
So talking to people on the ground, the numbers are fairly quietly sort of low as far as patients who've got COVID-19. So we must continue to distinguish between people who are positive for the SARS virus and people who've got a disease related to the virus. So COVID-19, the numbers of people who are in hospital is fairly small. Many of them were in hospital, have been in hospital for a good while. But we've got a high number now of what are called coincidental or incidental COVID findings. I don't think it's incidental COVID, it's incidental SARS positive.
Right. And does that mean that many people are still coming into hospital for something else and then kind of testing positive for COVID while they're in there?
Yes, absolutely. So that's the incidental COVID.
Oh, okay. And there's a lot more of that, isn't there, than we were first led to believe?
Well, as Omicron spreads through society, it's just going to be present within a certain percentage of the population and those people coming into hospital. And if it makes you a little bit unwell at the same time, then it will slightly be more predominant in the population of people who present to hospital.
Okay. And how are you being perceived these days, Dr. Steve? Because since you've been on my show, and I know I wasn't the first person to talk to you, but you seem to be everywhere these days. You seem to be a man very much in demand. How are your colleagues seeing that, and how are they sort of treating you, if at all, any differently?
Well, I've been someone who's come out and spoken out, and there haven't been that many doctors in my position who've been speaking with the line that I have. I know many more who feel the same way as I do, but don't feel like going in front of a camera.
Right.
And as I went in front of a camera a couple of times and didn't fall over myself too much, I've kind of been offered every other interview going, I suppose.
Yes. No, but I mean, you've done it very well. But it was one of those moments. I mean, when they do the review of the end of the year, if they've got any brains, they'll, your encounter with Sajid Javid will very much be part of that, because I think you can't take away from the fact that was quite a seminal moment for people like us who believe in freedom of choice.
Yeah, it was, and it was the fact that a voice was put out into the mainstream media saying, I've got questions, I'm not happy with the policy. And thousands and thousands of people, probably hundreds of thousands of people, if not millions in this country, feel that way.
Yes, exactly right. So what's next for you? Does it look as though you'll be able to stay where you are and continue to do what you want to do, rather than having to, because you were willing, as I think you said when you were here with me, to walk away from the job if necessary? Yeah,
well, I've mentally packed my bags and was prepared to leave. I've set up a couple of training courses that I'm going to be going on starting soon, because those were going to sort of support me doing other things in the world. I'm interested in trying to promote health rather than just work at the end of critical care end of the spectrum of health and disease. So I'm looking to see how I could still keep some of those things going while maintaining my hospital base.
Yes, and just going back on the sort of the timetable of this Sajid Javid sort of consultation, if you like. I mean, are you aware that there's any meetings set up, or is anybody going to ask your opinion on anything?
To share with you, we're still waiting for clarification. Right. A letter's been written to Secretary Javid by Stephen Jackson, the lawyer, asking for a clear timetable.
Right, okay. Interesting. So we'll keep an eye on all of that. Dr. Steve James, thank you very much indeed for your time.
Good talk. Hot talk.
Bold talk. Talk radio.
Listen on your smart speaker.
Watch it live on your smart TV.
The world headquarters of common sense.
Talk Radio.